And to kick us off this morning, it is my pleasure to introduce Secretary Ryan Stewart. Secretary Stewart has been both a teacher and administrator. He began his career as a math and science teacher in California. He earned his Bachelor of Arts in Economics from Stanford and has a doctorate in education leadership from the Harvard Graduate School of Education. Secretary Stewart has worked extensively in the areas of school improvement and innovation, and please join me in welcoming New Mexico Secretary of Education, Dr. Ryan Stewart.
Thank you, Greg, and thank you to all of you who are joining today. I'm very excited for everybody to be here to celebrate the 20th edition of this wonderful gathering of health professionals who are so dedicated to the ongoing health and safety of all of our students, both physically and emotionally as they're in the classroom. I couldn't think of a more important time or more important topic to really be diving into. So again, I'm just really honored to be your speaker here today. One thing I would say as I'm starting here is I think my bandwidth has been kind of going in and out. I've also joined by phone, so as I see people here in the boxes, just wave at me frantically as I'm going through. If for some reason I'm fuzzy, and I will unmute my phone and join that way, and hopefully keep everything rolling. But I'm excited to just talk a little bit about a few aspects of this particular moment in time, and how our school health officials and the work that we're going to do around both their physical and social emotional health, both now and over the year to come, a few tips and pointers around the importance of that and the complexity of that in this particular moment. So let me share my screen. Okay, and hopefully you can see this okay. Again, please wave at me frantically if it's not showing up in the way I hope it is showing up. Okay, but it looks like we're good. Is that advancing okay? Does that advance really briefly? All right, great. So again, congratulations, 20 years, quite an accomplishment to be able to celebrate here with you today. I think that your work has really never been more in the spotlight than it is right now. Every conversation that I have with educators, whether it's an administrator, a teacher, a counselor, a food service worker, the toll that our current moment is taking has really shined a spotlight on the need for attending to the social and emotional needs of all of our children and all of our staff. So I want to flash back just a little bit to life pre-COVID, if any of us can remember that. Feels like many, many eons ago. And when we think back to life pre-COVID, we know that here in New Mexico, we had many strengths that we were building on, and also some significant challenges that we were facing. So I get the great privilege in this job to be able to travel the state, meet with administrators, meet with students, meet with teachers, meet with health professionals, and really get a chance to see all of the different things that are happening. And there's no shortage of artifacts and schools that are really trying to make solid advancements when it comes to social and emotional health. So this artifact that you see here comes from Las Cruces, Camino Real Middle School in Las Cruces, where they were several years into their work around restorative practices and making sure that they were really training all of their staff and students in that. And so I really got to spend a day listening to the president of the student council there as she talked to me through all of the work that they had done from the time when she entered the school till flash forward a few years later, and the difference that it had made in the well-being of kids and the relationships between students and staff. So kudos to that school, and we know that there are many schools all over the state engaged in similar types of practices, whether it's restorative health, whether it's through their community school efforts, or whether it's through the work that they've done to strengthen the physical well-being of their students. We also know that one strength that we have throughout the state is our network of school-based health centers. And our school-based health centers play a critical role in making sure that we're able to address proactively the needs of students and their parents and their families when they are facing a health challenge. And we applaud all of the partners who have made that possible, both in our agency in our Department of Health and other partners throughout the state that have attended to make sure that we have a strong network of school-based health centers. And we know that this network is only still needs to grow to try to deepen both the breadth and scope of the work of our school-based health centers. But despite the fact that we do have some very exciting work going on, we know that New Mexico faces some really daunting challenges, and we had even pre-COVID. And so when we look at things like the Annie E. Casey Foundation profile, we know that New Mexico, when it comes to health, has some very challenging conditions, both when we talk about physical health, when we talk about some of the socioeconomic indicators that are very highly correlated with health and educational outcomes, including things like number of children who are living in poverty. So we know that pre-COVID, there was a lot of great work going on, but some really significant challenges that we all faced. So now flash forward back into March, and we all saw together and have experienced together how everything has changed. And in those months since March, we know that our students have, and our families and our societies and our businesses have faced unprecedented circumstances where they've had to close and isolate and do everything that we can to stop this virus. And in doing so, while it's absolutely necessary that we make sure we prioritize the health and safety of our students and our families, we know that this virus does not impact everybody the same way. We know that when it comes to the impact in terms of a physical health condition on both New Mexicans and across the nation, we see very disparate effects in terms of the way that it has hit certain communities. And we've all known and seen on the news about how much our Native American communities especially have been disproportionately hit by this devastating disease, resulting in the closure of cities, resulting in very widespread rates in many of our tribal communities. And we also know that this is hit differently based on income. We're a state that has many challenges when it comes to infrastructure for broadband technology. And so we know that when we had to go overnight into this new mode of learning, that many of our areas, especially in rural communities and low-income communities, were not equipped to be able to seamlessly move into a digital and online space. And you see the differences in income here between who was able to continue to access their learning program online and who had challenges to do that. So we know that through these disparate effects, they disproportionately impact our communities of color. And the vast majority of our public school students are either low income or a student of color or both. And so these are the students that we see every day, the students that we love and who rely on their schools for not only a great education, but for many other services. These are the ones who oftentimes have been hardest hit in this moment. So to put this in context, I like to, I've been reflecting on my own life experience during the recent pandemic. And in many ways, I feel incredibly fortunate to be able to have a number of facilitating conditions that help for me personally to mitigate the worst impacts of what this virus could do. I'm fortunate enough to have job security. The public education department is not a business that's likely to be shuttered during this pandemic. And because of that, I have financial security. My ability to continue to work has not been impacted by this. I'm blessed and privileged to have housing security and not be one of the millions of people who are facing uncertainty about their rent and the end of rental assistance and a hold on evictions. And we know many of our families are worried about the immediate future when it comes to their housing security. And I'm fortunate enough to have the ability to telework and be able to limit my exposure to the virus, even as we know it's continued to grow in our city, in our cities, in our state, and also across the nation. So for me, when I look at many of my facilitating conditions, I'm able to really be in one of the more advantageous positions, and many of the people who are on this call have similarly been able to be in advantageous positions when it comes to making sure that we're able to continue working, continue providing for our families, and continue to make sure that the limits of our exposure to the virus are maintained. So in this picture here, you can see both my little dog here and my son. I think the dogs are really the real winners when it comes to having. I think he has certainly enjoyed having his people around all the time, even as we have adjusted to our online learning life and many of the other factors that go along with trying to survive in this moment. But despite having all of these facilitating conditions, it doesn't shield either me or any of us from these really devastating impacts of COVID. So when I look at even my own experience, where I've had all of these privileges and am fortunate enough to have been able to engage in the ways I have, it hasn't been able to shield me, nor has it been able to shield many of us from the uncertainty that we face on a day-to-day basis. And the sense of loss, both loss in the very visceral sense of people who have lost loved ones, and we're up over 140,000 and climbing in the number of people who have lost loved ones. And it doesn't shield any of us from the resource insecurity that's there. We came out of a legislative session back in February, extolling the great investments, the historic investments that we were able to make in education and the new programs that we were going to be able to start, and the significant infusion that we're making to our statewide reserves. And now we know that we all face unprecedented budget deficits. And the full 180-degree turn that we have since made has taken an impact across our state government and across every aspect of our lives. And of course, none of us have been able to be shielded from the isolation and the lack of control that this virus has. It doesn't follow a timeline. It doesn't follow a pattern. It waxes and it wanes. And so we are all, in many cases, having to deal with a completely new set of challenges related to trying to tackle this and trying to tackle it in many cases at a distance from those who we know and love. To further compound this, we also find ourselves in the middle of this extraordinary moment of racial reckoning that has happened as we've seen the killing of George Floyd, Breonna Taylor, Elijah McClain, and the protests that have taken part both from coast to coast and also across the world as we've come to grips with the racial reckoning that is a part of responding to the outrage that so many of our communities feel. And as a state where our children, the majority of whom are people of color, they're watching, they're listening, they're marching, and in many cases, many of our students are going to be coming back into the school setting really hurting after experiencing the unprecedented nature of what we've dealt with. This on top of and layer it on top of the impacts that it's having across the world and across our nation. So as we begin the 2021 school year, I want to offer just a few points and a challenge around really building a culture of social and emotional learning staff and our students. This is as complex as it's ever been and as important as it's ever been. So as I move forward here in these next few slides, I bring these to put forth to all of those who are watching here today the fact that the contributions that all of you make to making sure that our students have all of the supports, all of the resources that they need in order to be a fully cared for and loved human whose health matters deeply to all of those around. We have to build the systems and the structures that will bring our students back into the schools while not only attending to the academic loss, in which we know that there has been academic loss, but also attending to their social and emotional well-being. So when I talk about building an SEL culture, a social and emotional learning culture, one of the key parts of this, and something that I'm so grateful to have the support of Deputy Secretary Sandoval and Greg Frostad and so many, both at the Public Education Department and our partners in state government and in the nonprofit space, is really this idea of integrating our wraparound services fully across the spectrum, both in partnership with the academics, but really holding these front and center. And so one part of that I'm really excited about, and I just want to thank all of the PED team for their leadership in this, is our work to build out a statewide social and emotional learning framework. And I'm incredibly excited to be able to say that we've been able to dedicate some, both not only personnel, but resources at the Public Education Department to really focus on this and help lead the statewide effort to make sure that social emotional learning takes its place with a clear framework for how to implement it right among all of the other academic disciplines. Second thing I'm really excited about as well is our continued partnership around behavioral health. If any of you have had the opportunity to listen to the governor speak, I think she is a passionate champion for behavioral health services across the state. And as a secretary who is every bit in favor of being able to make sure that we're able to provide our kids everything that they need to thrive when they come to school, it really is an honor and a privilege to be able to work for someone who feels so passionately about this work and who has made it her mission to have a behavioral health collaborative that really rebuilds the statewide infrastructure that for too long was allowed to languish. And so we're actively working across agencies to really see how we can continue to partner, how we can continue to bring more resources in the state, both from the outside and also using federal resources as well, so that we can have a strong and vibrant behavioral health ecosystem everywhere you go in the state. And as many of you here know, our community schools effort has also been a key point for the governor. It's a key point for the Public Education Department. And we are excited to be able to continue to invest more deeply into our community schools. And I think one thing that I'm particularly interested in is being able to show off New Mexico as having the most impactful and goal-oriented community schools in the nation. So we know that there's many community schools, both locally and nationally, that do a lot of great activities, but doing a lot of great activities isn't enough. We know that our community schools are in a position to really build on the assets that are in communities and be able to help communities come together to solve the biggest challenges that are facing their students and their families in order to be able to have a thriving community. And so the more that we're able to focus those efforts and have clear goals and outcomes on what it is that our schools want to impact and how we leverage the assets that are in communities to do that in partnership with our families is a critical piece to making sure that our community school efforts have the kind of sustained and long-term impact on community health and on student health and on student well-being, and then of course translating into student academic success based on the work that we do. Another pillar of building the strong SEL culture is really engaging deeply with our families and communities as our partners. And I love this framework that I've taken from a book called Beyond the Bake Sale for those of you who are familiar with it. And that's this notion that to build a strong culture of social and emotional and a strong foundation, it all starts with having a healthy relationship with the family and with the student when they enter the school. And for schools, this can oftentimes take a paradigm shift into how they think about coming together to build and address a culture that really does embrace families and set that strong foundation. And so the way that this framework works out, it starts from what we call this, on one side of the continuum, a fortress school. And in a fortress school, as you can imagine, a fence and a moat and kind of setting apart. It's a notion that left side of the continuum where we don't value education, and we think of this quote here around, we'd be a good school if we had different kids in a better neighborhood. So in that fortress school mentality, it inherently breeds a sense of conflict and mistrust, upon which it is incredibly difficult, if not impossible, to have a strong social and emotional health framework, because inevitably it's all based on this notion that of them versus us, and a battle coming in and trying to set apart. And so the foundational piece for so many of our schools is moving away from a fortress school model. The next part on the continuum is this come if we call school, where we'll call the parents if we need them, but it's all about the school setting the terms and the conditions. And again, if you're in that come if we call school, that suggests that families don't have much to offer to the school in way of being able to bring assets in and bring expertise into the school. So moving forward on the continuum, you go to open door school, where it's very activity driven. We have a lot of things for parents to do. They can come in and they can see this nice play or attend this nice event, and you start to scratch the surface a little bit of being able to bring people in, but without much depth, without much to really build on. And so what we're really working toward are building more partnership schools. And I think our community schools effort really exemplify this in many ways, because when we do that, we recognize and we value that our parents and our families and our communities are fundamental to part of building a healthy ecosystem, a healthy partnership with the school, and that we're going to work with the parents to do whatever is needed to wrap around them the services that are required to help every single student thrive when they come into the building. And in addition, we know that it's critical, if we're going to build a strong and healthy social and emotional learning framework, that it has to be about shifting mindsets and beliefs. I came across an article just the other day, which I was actually very surprised by, that corporal punishment is still a practiced and legal way of interacting with students in 18 states across the country. So in 18 states across the country, when we think about social and emotional health, you think about the students who are sitting there wondering, if I bring myself into this classroom, if I make a mistake, if I do something, am I going to be physically in danger every day? And what that does to the social and emotional well-being of the children in front of us. And so when we think about social and emotional health and that social and emotional culture, so much of this has to be about shifting the mindsets and beliefs that are present in our schools. And so for so many of our staff and our teachers, getting to the point where we know that, and we are committed to social and emotional well-being of students being front and center in everything we do, is not yet a established and practiced and ongoing part of the repertoire that people are naturally born with. It takes training, it takes thought, it takes coaching, and it takes so much in terms of being able to integrate this across the continuum of schooling. So shifting the mindsets and beliefs of people toward building that social and emotional learning culture and recognizing it as something that is critical and inherent, just as the academics are, requires shifting those mindsets and beliefs. And I love this framework. This is from Glenn Singleton's work that he uses when he has courageous conversations. And he thinks about it in the racial context. And I think about it, it has so many other applications across the spectrum. And that is when you're trying to shift the belief of someone. For many people, it takes really hitting that moral and emotional center that they have and connecting with them on that level for them to understand and internalize a new mindset or a new belief and start to move that forward. For others, moving their mindset or beliefs requires tapping into their intellectual center. Those are the people for whom you need to bring out the charts and the data and the research reports and the books on implementation, and show how if you do X, it can have Y type of impact. And then there are still others where shifting the mindset and belief is all about a relationship. I will do this because I trust you. I will do this because I feel like I need to be in deeper relationship with this student, and you need to help me build both my relationship with you as a coach or a mentor or a leader, and my relationship with my student as me as a teacher or a counselor or a mental health professional or a bus driver, and with that student and with that family. And when this is really working well, oftentimes we'll find leaders who are operating at the center of this compass and who are dynamically moving between tapping into the moral core or the emotional core or the intellectual core or the relational core of the colleagues and the families that they're helping to lead toward this journey. But no matter where you fall on it, taking some time to step back and reflect on how am I in my relationship with any individual as I'm trying to lead an effort around building a social and emotional learning culture, tapping into what that person needs to move forward. As we move forward together as a society, and again, thinking back to the unprecedented moment that we're in, we know that our students are seeing across the entire nation and in some cases in their backyards, this shift in mindsets in the symbols and the actions all around them. They're going to be carrying their perspectives and their experiences, their hopes and their frustrations, their joy, their pain, their trauma. They're going to be looking to you to help carry and process the weight of these experiences as they come back into the school buildings. And this on top of everything that we talked about in the impacts of COVID and what that has had on the impact of communities. So we know that the work of everyone to keep our kids socially and emotionally healthy and sustained during this time has never been more complex, has never been more important. So in thinking about the actual implementation of creating a strong social and emotional healthy culture, it's important that we not look just at the individual actions or the individual actors, but that we also step back and take a moment to look at the systems that can undermine social and emotional health and actively do the work to try to interrupt some of those systems. And these are certainly not an exclusive list, but when we think about some of the big ones, we need to think about what are the systems and expectations for the ways in which we communicate with kids. The ways that we talk to kids matter. The language that we use, the way that we talk about communities and families, that matters. And the systems that we put in place to either set expectations or not set expectations communicate something to kids. And it communicates how much they can trust. It communicates how safe they can feel. It communicates how much can I invest in the relationship with this school, with this principal, with this teacher. And so thinking clearly and deeply about what are the systems and expectations around the communication and the language that we use with our students and families, and how does that either contribute to or undermine what we're trying to accomplish in terms of building that culture. In addition, exclusionary discipline. We know when we look at the data about who is taken out from class, who is sitting in the office, who is suspended, who is expelled, we know that we see clear markers across racial and demographic lines. And again, that communicates something, that says something about the systems that we use in order to make sure that our students are cared for, that they're seeing us, that they're seen, heard, and safe in a classroom. And finally, deficit-based practices and policies. Taking some time to look at what is it that we're doing, what policies do we have in place, and how is it impacting people? Having those conversations with groups of students that you see being the furthest from success to understand what is it that we're doing at a systemic level that might be contributing to that, and actively working to interrupt it. So we know that if you have a student who experiences devaluing and dehumanizing experiences all day and every day, that having a 30 or 40-minute lesson on social emotional health that they experience once or twice a week isn't going to undo that. in order to really make it something systemic and make it something that bleeds into the culture of a safe and socially and emotionally healthy school, that those kinds of practices that we see in the social and emotional curricula have to take root across the school day for our students. It takes a systemic approach to promoting this kind of student health and affirming our kids throughout the day as they go on to actually have a strong social and emotional learning culture. And then in addition, then comes the very hard part of translating that rhetoric of socially and emotionally healthy schools and putting it into reality and attending to the complexities of change management that are inherent in that work. And so I love this continuum of implementation that you see here on the left-hand side, where you can have a really nice plan on paper, we call paper implementation. But again, that just makes for a pretty binder that sits on a shelf that at one point in time had some good ideas in it. But we need to move more toward process implementation, where we're actually taking the stuff that's in that very pretty binder or Google folder and actually start putting it into practice so that we can get to performance implementation, where it's not just a binder, it's not just a series of activities that we've done, but to the point where we're really changing behaviors and making impact. And so stopping to reflect and think about the implementation science of the social and emotional learning actions and systems that you're building in your school. And to do that well, it takes building ownership and commitment, not just of the leadership, but amongst your teachers, amongst your students, amongst your counselors, amongst your nurses, amongst your families, and showing that there are practical and useful benefits that come, and being very clear on what they are and helping people to see what making those changes can do in terms of the impact that it has on health, on relationships, and on outcomes for kids. And finally, it requires ongoing and sustained commitment from administrators and from leaders to keep going even when it gets hard, to keep going even when there are a million other things and you're trying to put out your daily fires, stopping and not backtracking on being able to keep moving forward.
Thank you to Dr. Stewart for helping to present his vision for how New Mexico can use strategies such as the focus on social and emotional learning, behavioral health supports, and the Community Schools Initiative to not only help New Mexico students move academically, but also to create those stronger New Mexico communities. We hope to be able to provide resources to all of you, to the attendees during our sessions that will help to move into performance implementation on that SEL culture, just like Secretary Dr. Stewart was mentioning. And up next, we have our second speaker, Dr. Thomas Massaro, the Chief Medical Officer for the New Mexico Department of Health. He has engineering degrees, so settle in. His degrees are a little intimidating. He has engineering degrees from MIT, Cornell, and a PhD from the University of California, Berkeley. His management degree is from the Stanford Graduate School of Business. His medical degree is from the University of Wisconsin-Madison. His postgraduate training at the University of Colorado led to board certification in pediatrics, neonatology, and pediatric critical care medicine, Dr. Massaro has addressed health concerns globally, from the Czech Republic to New Zealand, Botswana, as well as in the US. He has lectured extensively on healthcare policy, health reform strategy, and change management in the healthcare environment. Please join me in welcoming Dr. Thomas Massaro.
Greg, thank you for that kind invitation, introduction. But I really want to make sure you all understand that I know my role. Second slide, please. I know my role in this conference. Next slide, please. As you've seen, I have a relatively humbling task of speaking in a slot between two great speakers. You've seen the power and the charisma of the secretary in his introduction, And I'm sure you'll see an equally thoughtful, committed, and sophisticated conversation from his deputy. Both of them are great people and probably friends of many of yours. Next slide. On the other hand, I'm really the outsider, the bad cop. I'm brought here specifically to say things that nice people don't want to say to their friends. My job is to tell you, if you want to see schools opening, then you should definitely wear a mask, even if you really hate the idea. I'm here to explain why and how you should manage your schools very differently this year, even though you've managed them very well in the past. It's really critical that these concepts be said, and I'm really honored to be invited to say them here. Next slide, please. This is a slide that basically shows why we're in the conundrum which we are. The multicolored lines show the rate of the 7-day average of positive cases in New Mexico through the 23rd of July. The most important line is the top one, the dashed blue line, which shows a 125% increase in positive cases over the past 5 weeks. New Mexico has the most limited intensive care services in the country per capita. We cannot afford to have that kind of surge maintained. It has consequences across the board, and for this conference, clearly, it has significant consequences for our schools. Next slide. When Secretary Stewart initially announced the school reentry program that you all know about, it was early in June. His decision was based on some relatively positive data that had occurred in late May. There was a blip from the correctional institutions in one of our southwestern counties, but we were pretty confident that we were on the right track. And you see the gray line heading to the lower right on this curve, which is where we thought we would be today. We are not there. We are, in fact, in where I showed with the red arrow in the previous slide, and that brings us to the challenge of why we have to do things differently, fundamentally differently. We have to wear masks even if we hate the idea of wearing masks. We have to change our behaviors even though they've been successful for many years. Next slide, please. One of the conundrums that have really hit us lately, particularly those of us that are interested in, I'm a pediatrician, so I'm interested in young people and young people in schools. The left-hand curve on this slide shows that since the beginning, we've had about 10% of the positive cases in New Mexico in the age group of 10 to 19, and a little less than 5 in the 0 to 9 age group. In the week prior to July 22nd, on the right-hand curve, you can see that both the 0 to 9 and the 10 to 19 curves have risen significantly. The 10 to 19 curve has actually risen 50% over the past week. So we don't quite understand that. Obviously, we need to understand the behavior of the virus in that age group. Next slide, please. We know that American Academy of Pediatrics looks at the number of positive cases per 100,000 people across the country. When Janice Gonzalez, one of my colleagues who runs the Family Health Bureau in the Department of Health, when she first started bringing this to our attention, New Mexico was the second highest percentage of children positive of all of the tests that were run. We think that that was due because at that time, and continues, New Mexico was among the leaders of the states in the United States in our efficiency and our effectiveness of testing. So we were just seeing more. Over time, as the issue of school reopening becomes more and more important, other states have begun to look at these issues and have begun to test kids more. And you can see we've gone from number 2 to number 12 in this curve. And you can see the states ahead of us. Initially, the only state ahead of us was Wyoming. You can see the states ahead of us are primarily from the South and the Southwest, where the big surges are taking place in the United States today. Next slide, please. This is another slide from the American Academy. It shows that almost every state in the country is showing an increase in the percent of positive cases for children in the past 2 weeks. This morning on the news, I heard that Florida, which I think most people know is experiencing explosive growth, in the last week has experienced 36% increase in positive cases for children, but more importantly, has noticed an increase of 23% in the hospitalization for children. So I don't, at least this morning, I don't have good data on our hospitalization rate. I'll try to get that and pass that on to you, but I'm pretty sure our hospitalization rate for children is much, much less than that in New Mexico. Next slide. The next slide summarizes what's really happening in this demographic of age. The orange line is the percent of cases for the age group over 30. Probably most people in the audience, certainly your speaker is well into that age group. Over time, over the past 100 days or so, the percentage of positives of the total caseload has gone down to 56%. When we first started, the under 30 age group, the blue line, was relatively small with relatively limited health consequences. Over time, over this past, again, 12 weeks or 15 weeks or so, we see that the number of cases for the younger population in the society has increased significantly, and more the medical literature is telling us that the health consequences for that population are much more severe than we had thought way back in March when we were focusing on the elderly, with pre-existing health conditions in nursing homes, that sort of thing. So we have new data that we are trying to understand and see how it fits into the whole issue of reopening schools. Next slide, please. One of the ways that we're trying to understand things about reopening schools is to look at other countries that might be ahead of us in the reopening. It's good, it's positive, it's optimistic to be able to report that European, Asian, and South American countries have all many, not all, have successfully reopened schools after slowing the spread. On average, across the globe, those countries were were able to reopen their schools because they waited to about 30 days on average after the infections had peaked before they reopened. As part of this reopening, the consensus among all of these countries is that younger children are less likely to transmit the disease than older children, adolescents, and young adults might be. Across the Economist had a nice review last week about all of this, and they suggest that the approaches to minimizing risk in these countries include masks, social distancing, letting the most vulnerable teachers stay home, reducing class size, staggering timetables, reducing crowding at dining halls, all of which are proposed for New Mexico. So we know conceptually how to do it. Next slide, please. The data are not as clean as I implied from that last slide or as suggested in the Economist article. There are conflicting papers that are out there as we look at that. For example, there are 2 German studies that showed that even when you look at teachers in secondary schools, 8th through 11th grades, 2 German studies showed relatively low seropositivity from antibody studies. This measured the immune response after infections. They suggest with the low seroprevalence that neither kids nor teachers were increasingly affected in school reopening. A bigger study appeared last week from South Korea where they looked at individuals and they tested for active infection, not antibodies, post-infection studies. These are individuals who are measured during their infection and their transmissibility. They showed that less than 10 years of age were much less likely to transmit the disease. But beyond 10 years of age, the transmission was similar to adults in contrast to the German results. Sweden, we could do a whole conference on the Swedish experiment in COVID, but the reference for Swedes related to schools is that they look back in their attempt to develop herd immunity, and they found that the staff at nurseries and primary schools, neither of which closed in Sweden, were no more likely to be infected than those in other jobs, so that there was no additional risk of having an open school. But the 2 probably more important studies that I quote are from 2 countries which were very successful at flattening the curve early on. Israel had done a great job, but they opened up very rapidly and their results were really disastrous. And I quote a number from one of the Israeli newspapers that of the 1,400 individuals diagnosed positively in June, 47% of those people were infected in schools. So it's a significant issue for the reopening. Now, Uruguay, I've never been to Uruguay, and actually I admit I don't know a lot about Uruguay, but it's clearly the best performing country in South America. They were very effective at initial flattening. They staggered their reopening. They opened their rural school first, in part because the rural schools had less access to distance learning technology. They opened their special education group second because they felt they were the ones that maybe needed the face-to-face more than anyone else. And then they finally, once they had learned from those 2 initial steps, they opened their urban schools eventually. On balance, overall, their approach was uneventful. So the summary, I think, of what we know from looking at the global health experience is that good evidence that schools can be reopened safely if we wait till we are in a period of decreasing positivity. There are no data to show that any country has opened schools successfully in the period of explosive surging that is taking place. So we have three choices. We can just accept the reality, go forward and take the consequences. We can say, gee, we are surging here, we better back away and not reopen. The third consequence, which I think the public health community is most supportive of, is to say, let's be as aggressive as we can to try to suppress the surge, to try to flatten the curve, to try to get us back down to where we wanted to be. Next slide. Well, we've got this slide. Let me give you some recommendations for how you're going to manage your schools differently during different points of time around a COVID infection. And it's important to remember that this is really a work in progress. We're only 6 months into the pandemic. We're learning as we go. People get frustrated with the public health community that we sometimes change our mind and our recommendations, but we try to do it on the best information we have. So let's look, next slide. Let's look at the actions prior to school reopening. We suggest that every school, regardless of size, appoint a COVID point person who will become especially familiar with all of the issues of that particular school. Where's an isolation room? Where's the various equipment kept? Those sorts of things. The point person should also be aware of public health resources in the community, nearby, hospitals, clinics, testing sites. The school leadership should communicate to all of its stakeholders, all of the individuals, all of the groups that have an interest in schools. The change that's most recently occurred, and it's I understand the frustration, but we no longer recommend or require that all staff or students be tested for the virus in advance. So that means that basically people will be coming in and we will be responding to any positive incidents immediately, but we will not be dealing with entire populations in a surveillance mode. Next slide, please. Okay, behavioral modifications in the classroom. Again, my top, masks. Masks required for all staff and students greater than 3 years of age. There are exemptions for special education and certain health conditions, and you can get your medical exemption forms from your COVID point person. We need physical distancing when at all possible. Hand washing or sanitizing stations should be readily available. Reduce class size, reduce group sizes, and manage meals as effectively as possible. Next slide, please. Okay, if you were to get a positive test in the school, contact the DOH immediately and initiate the rapid response protocols. Immediately isolate the individuals and arrange for her or him to leave the premises. Facilitate eventual contact tracing by identifying the recent movement of that individual and his or her actions. The DOH will work with you to decide what part or if all of your school need to be closed. We won't automatically close the whole school. We'll decide on whether you need a room, a floor, or a wing based on the traffic or the travel of the individual patient. And then we'll initiate cleaning and sanitizing procedures. Next slide. If someone is positive, is quarantined, isolated at home, we've changed a bit on our requirements for return to school. For asymptomatic individuals, we now require at least 1 day without a fever, plus 10 days when the the symptoms are being reduced. But we're no longer asking people to have negative one or more negative tests prior to the return. Next slide, please. For asymptomatic individuals, we want to wait again 10 days now till the date of the positive test. That assumes that no additional symptoms have been presented. And if the new symptoms are identified, then you have to start over with the previous slide on symptomatic individuals. But again, in this case, asymptomatic or symptomatic, the previous idea of getting negative tests before people can return is no longer necessary. Okay, final slide. Be safe. Work intelligently. Don't work in a biased way. Try to keep your colleagues and students safe. Wear masks. Space your distances. Wash your hands. Be very mindful of the negatives of the virus. And thank you very much for listening to me this morning. I think these slides will be available to you. I know I went pretty quickly. Thank you very much.
Thank you, Dr. Massaro, for providing us that data. Though we may not want to see it right now, it doesn't look the way we would like it to look. But you've given us some strategies for how we might make those numbers look better, what we can do ourselves. So thank you for that. For our final speaker for the first session of the SHEI 2020, it is my pleasure to introduce to you the Deputy Secretary of Academic Engagement and Student Success, and the best supervisor I could ask for, Katarina Sandoval. She received her bachelor's in education from Stanford and her master's in education from Harvard University. She has been in education for more than 20 years, 10 of those in the classroom before becoming an administrator at APS and Senior Director of Academic and School Performance for the Native American Community Academy. Welcome, Deputy Secretary Kata Sandoval.
Thank you, Greg, and good morning, everybody. I also wanted to thank Dr. Massaro for his presentation. It's been wonderful to have the collaboration and the partnership with the Department of Health, and we're very fortunate to have him on our team. And I really want to just pause for a moment and thank the Safe and Healthy Schools Bureau and Greg and all of his team for continuing this important work. And it's wonderful to know that this is the 20th anniversary of the SHEI. For many of you on this call, seeing that yucca inevitably reminds me of Dean Hopper, who retired in February of this year. And so I want to just also recognize Dean and his work and the legacy he has left us in collaboration with all of you. So very thankful for that, and wonderful to know that SHEI is continuing in its 20th year. So the last part of today is really about what can we expect. And I can't emphasize enough how important you all are to welcoming back our students when the time is ready, to have them come back in person, to really lead with support, to lead with social emotional learning, as the Secretary mentioned previously. And really, what does that look like in the day-to-day? I think that we all recognize the importance of relationships in the work that we do. And I'm a secondary teacher, but even then, hugs and smiles and facial expressions, tone of voice, all the things we know that our students are paying attention to and the things that matter as we develop positive and healthy relationships with them will be tricky, right? With masks on, or will be tricky as we're trying to do it through Zoom. So really, what does that look like? And so I wanted to start off with just a few cartoons, if you will. And I want to pause on this first one. As you can see, we have a family here. Parents are wearing their masks. Children are obviously beyond wearing masks, headed off to school. And so we all know that there will be students who are obviously concerned about getting sick. They may have experienced family members who have been sick, unfortunately may have passed from complications, but are just, concerned about keeping themselves safe and not getting the virus. Clearly, we'll have parents and families who are feeling the same way. So we will have children who are compliant. They will be wearing their masks. There will be families who are worried about other children who may not be as compliant. And so the more that we can recognize and mitigate, and as Dr. Massaro so clearly said, this is not political, it's safety. It's the health and well-being of everyone involved. We also know, I'd like to pause and say here, that there are parents and families across our state who are not comfortable with sending their children back to school, even when we reopen schools for in-person learning, and that's okay. We want to support them as well. And so the PED has given guidance to all districts that they are to provide a fully remote learning option for all families who request it. And the PED has provided a learning management system at no cost to districts for that very purpose. Many of our districts already have either fully online instructional programs or fully online schools. For example, APS has the Academy. That's wonderful. We want to continue providing those options to families and students, but particularly now. So again, for districts who do not have an online school or online program, they will be able to work with us to provide that free of charge to their students and families. The other thing that we're really excited about with our learning management system is that it also includes modules and support for families who may not know how to do that at home or have really struggled with it these past few months. So we made sure that we wanted to get a management system that was not just for the students, clearly for them, but also for their families so that they can also learn, how do we log on together? What's your schedule gonna look like, right? Is my child supposed to be on Zoom from 9 to 3? Do they get breaks? This system will help structure the day for families and students in a very real way that's age appropriate and give them the content that they need. Next slide. And we know that just like we'll have some families and students who are going to be compliant, maybe very super cautious about returning, we'll have the other side as well. You can see in this cartoon, we have an older gentleman who's wearing his seatbelt. He knows it's important to do that. He's happy to go through security screenings at airports. He's wearing sunscreen as he's outside, but there's no way he's going to wear a mask. Right? And this is really just to highlight that there are going to be families and students who may not feel like wearing a mask is in their best interest for whatever reason. They just believe that it's not a necessity and they don't feel perhaps that their children should be wearing a mask when they return to school. And I really, again, want to just say that our expectation from PED, from Governor Michelle Lujan Grisham, we know that this is the #1 intervention to help stop the spread of the virus and to keep ourselves and our children safe. But to, again, lead with support for these families who may be struggling with this, who may feel like it's not something they're looking forward to, but we want to provide them perhaps with that kind of intellectual lead, as Dr. Stewart talked about. Maybe they need to see the data and the numbers. And so we're happy to provide these slides for you from Dr. Massaro and the Department of Health that helps you reach out to these families and lead with empathy, but to help them understand why the masks are so important. Next slide. And no matter what, how we may need to lead with support, use data, use empathy, use relationships, all those things we're going to need to lean on as we work with families and students. But we know that the most important perspective is that of our students, right? And that for many of them, like in this cartoon, they feel like they've been in a bubble. They've been inside forever. They want to see their friends. They want to be at school where relationships are. That is their world. And especially for middle schoolers, older elementary students, and high schoolers. And so to just be cognizant that their perspective in all of this is the most important. We want to keep that front and center and support them as they come back to school in very different circumstances. Next slide. In our reentry guidance for districts, they all have submitted their reentry plans for how to do school in 3 different models. One is complete remote model, which is how we're starting now in August. hybrid model when some students come back and some are still learning remotely from home. And then eventually our goal is to have full in-person learning. So we have 3 guiding principles, as you can see here, and the most important, and we're really excited for the sessions that we have in store for you today, is really about the first. How do we prioritize the health and safety of our students, our staff, and our communities with all of these very complex and moving parts? Next slide. As you heard Dr. Stewart so eloquently describe the need for social emotional learning, there is a huge need. There always has been, but now more than ever, given the global pandemic, given the economic crisis that has been occurring and will continue, we know many of our New Mexico families are facing eviction in the next few weeks and months. And we know the upheaval that can create for a family if they're displaced and looking for secure housing. There is this mobilization right now against police and state violence and systemic racism. I did see earlier in the Q&A, there was a question about policies and whether or not districts or schools should adopt a policy that bans any kind of racial symbols or icons. I think that's a wonderful conversation to have at the school level and at your local level. We know that districts currently have policies about not allowing students to have any kind of promotion of alcohol and drugs on their school property or their personal property while at school. Could there be, in addition to that policy, about racial symbols as well? Good question. Definitely good conversation to have with your school board or governing council. But we know that right now our country is really starting to, and here in New Mexico, right? This whole conversation about statues and honoring, Spanish conquistadores, is that appropriate or not appropriate? What a wonderful learning opportunity for our students to debate that, to research why is that even a question, and then potentially using that as a basis for a potential school or district policy. We also know right now social emotional learning is extremely important because you can see a little less than 20%, 16.7 to be precise, feel disconnected. This is based off a contract we had with Graduation Alliance. It was called Graduate New Mexico, Alliance New Mexico, to really reach out to students who kind of dropped off the radar in the spring, meaning they weren't logging in. The district hadn't heard from them. They hadn't officially withdrawn. These are youth we are calling disconnected, and we're reaching out in partnership to really do intense Tier 3 interventions to just talk to the student, involve their family, see what kind of behavioral and support that that particular family and student may need to make sure that that young person comes back to school and is building relationships with mentors. And then, of course, we have the Yazzie Martinez case that is bringing light to deep inequity issues in our education system that have existed for decades. And we are moving forward to make sure that we have the resources in place to address the needs of all of our students, especially those groups as identified in the legal case. Next slide. So social emotional learning is a priority for reentry. And I just wanted to bring to light some of the major categories in terms of what that means for the public ed department. First, we know that social emotional learning is deeply connected to culture and language and cultural relevance. We want to honor the identity and the cultural nuances by communicating, number one, important school information in multiple and appropriate languages, those that reflect our families and our communities. And we want to make sure that as much as possible, we include curricula in all classes that teaches students about diversity and anti-racism. We also know that relationships are paramount. We need to create a sense of belonging and connection, especially as students are coming out from several months of potentially being inside and isolated and not connected as they usually are to their networks. We can do this with regular check-ins with students and families, phone calls that the sound of a person's voice means so much. And so let's keep doing phone calls, video calls, emails, personal handwritten letters. It's all hands on deck as we create relationships and a sense of belonging for everybody. And we want to make sure that we create opportunities for students to share and process their emotions. And this is also not only true for our students, but for our staff. We have a new normal. How do we create new procedures, new ways of doing things so that folks feel as comfortable as they possibly can as we shift to this new normal? Next slide. And again, as mentioned before, we want to provide that real-time support. This is where all of you are so incredibly important to help teachers and educators recognize the signs of trauma and grief. We all process it differently. How do we help each other recognize when someone's really struggling with grief and loss, whether it's a student, again, staff, or families? And then how do we make remote learning part of our new normal? Right? So that, again, social emotional learning is comprehensive. It's embedded throughout our classes, whether it's in-person instruction or in remote settings. And how do we provide those daily routines that we know help reduce stress, help provide a sense of security in this new normal? That's going to be really challenging, but we know that with your expertise, we have the expertise here together in our state to do this for our schools. Next slide. The Attendance for Success Act is taking effect in next school year. And so students are expected to attend all in-person and remote learning programs every day. It begs the question, how do you take attendance when you're doing a Zoom class, right? How do you take attendance if a student is doing completely remote learning? That question is up to local districts and charter schools. So local districts and their school boards and governing councils need to develop policies and procedures that adhere to and follow the statutory requirements of the Attendance for Success Act. So again, each community needs to come together and say, how are we going to measure this? We know there are inequities. There are parts of our state where broadband is an issue. There is not enough infrastructure across our state to make sure that every home has access to Wi-Fi. That's a challenge. It's a real challenge for some districts. So we've encouraged those districts to use their CARES money, which is a federal source of funding, to purchase not only devices for every student, but also to try to create some hotspots where a student can, and his or her family can drive, download content, go back home, work on it, drive back to a hotspot and upload that content. These are issues of inequity that we need to pay attention to, take into consideration as we think about attendance. Again, that will be a local decision, but we really encourage everybody to think about equity as you develop these policies together. Next slide. And then just some final points about supporting students and families. We know how important it is just for a very basic level of providing meals. Our schools provide meals to most of our students on a regular basis in a way that's supportive for families. So we will continue to do that. Districts and schools will provide meals every day for those students who are doing remote learning per their first day of school. So just like they did in the spring, they did a wonderful job of establishing grab-and-go sites where families could pick up multiple days worth of meals. And there were schools and districts that also delivered these meals at particular bus stop and routes. And we want to continue to encourage our districts to do that. We will continue to apply for USDA waivers as those come out to states. We also are supporting all of our districts with childcare. Each district will create a specific plan that meets the needs of their community. The Public Ed Department is about to administer a statewide survey to all families that will ask them about their specific childcare needs. It'll be administered in English, Diné, and Spanish. And then each district will have a point of contact. Again, the PED is paying for all of this. And this point of contact, this person will work at the REC, the Regional Educational Cooperative. And their job is to work with every superintendent or his or her proxy to say, here are the results of this, this family and community survey about their childcare needs. Here are the assets that exist in your community. And then this person's point of contact is to work with the district to say, how are we going to support students and families and connect those dots. Immunizations are still required for next school year. And as Dr. Massaro discussed masks, we are really promoting, and we would love your support to really work with families to say, yes, there are mask exemptions for those students and staff who are medically fragile, who need them, but we really want to focus on what students can do with a mask on. We know, even my 12-year-old, she doesn't like wearing it, but each day she gets a little bit more comfortable. She keeps it on a little bit longer before she, tears it right off. And we know that it's just practice like anything else. Our students will get more and more comfortable with it. They'll get used to it, but they're going to need lots of support as they return to school to keep those masks on. And we appreciate your support with that. And again, we want to focus on what they can do. Can they wear it for 5 more minutes, 1 more class period, and then get better the next day. But just want to wish everybody a wonderful SHEI. You've got some great sessions coming up. Thank you.